You're watching Fox 10 Arizona Morning with Ron Hood, Rick D'Amico, Andrea Robinson, Kristen Anderson, and Corey McCloskey in HD. Coming up.
Yes.
There's a new way, instead of Botox and all the other fillers out there, how doctors can now use the fat in your body to fill the wrinkles in your face.
You're watching Fox 10 Arizona Morning.
Okay, what is it?
Okay, it's a
love bug.
A member of the family of March flies, also known as the honeymoon fly, kissing bug, or double-headed bug.
Oh.
The adult is small flying insect common to parts of Central America. A double-headed bug has a head on both sides. Especially, they find them in the United States along the Gulf Coast.
There you go.
During and after mating, adult pairs remain coupled even in flight for up to several days.
Wow, that's more than you'll ever want to know about a love bug. Coming from our Rick D'Amico. All right, from love bugs to plastic surgery, there's a survey from the plastic surgery industry found facelift increased 9% between 2009 and 2010.
So this morning, Andrea is going to show you, and maybe me if I pay attention, a procedure that reduces fine lines by transferring fat from one area of your body, where you might have a lot of fat,
yes,
to plump up your face. Take it away, Andrea.
Cheryl Van Meter is getting ready to celebrate a milestone birthday.
I'll be 60 fairly soon, and it's like time to do something for me.
That something was fat grafting, done by Valley aesthetic and plastic surgeon Jeffrey Ptak.
Well, fat grafting is not new. It's really been around for decades, but we're really just beginning to realize that I think, and a lot of other of my colleagues are thinking, that it really is as close to the fountain of youth for the face as we've come to. And I believe that it really is ultimately better than a facelift.
With aging, our faces lose volume and become sunken in. By putting fat from our own bodies back into our face, you get a natural, fuller, youthful look without that dreaded, tight and pulled look that can come from a facelift.
The procedure involves just removing some of your own fat from areas that we know, because all fat in the body isn't the same. There are certain areas where the body holds onto the fat for dear life, and so we want to use that fat and put it back in the face.
For Cheryl, Dr. Ptak concentrated on a few key areas.
We did through here sort of filling this and raising this area, filling underneath the eyes, so you kind of get rid of the deep set dark circles, crow's feet, which we all have, and then the forehead area, he concentrated on that also, and then of course the lips.
Her procedure only lasted about an hour. Before they started, she was given some medication to relax, as well as nerve blockers to make sure she didn't experience any pain. She was awake through it all.
So restoring the anatomy of the lip is important because they really begin to fade. We take a few small syringes and process them a little bit and purify the fat, and we re-inject it as a semi-liquid. And with some technique and practice and a lot of experience, we can reestablish a lot of the very youthful facial shape around the eyes, the mouth, and the jawline.
The beauty of this procedure, as opposed to other fillers out on the market, is one, it's natural, and two, it stays much longer, nearly 10 years in some patients, because it acts as body fat rather than facial fat. Days after the procedure, Cheryl had some light swelling, but nearly a month later, she was looking picture perfect. And the best compliment yet?
Well, it's interesting. They'll look at me and they'll say, "God, you look great." And it's not like, wait, what did you do? They're just kind of, it's like a question mark on their face. It's like, God, you look good.
She does look good.
How about this for a compliment? Hello, dear mama.
Rick said she looked very rested, and that's probably the best compliment of all. It runs about $3,500, and I mean, a facelift can run you, triple that. And she was good even that day.
So they take fat from, like, say, this part of the body.
Actually, they usually use, they can, but the inner thighs or the belly or the hips, where you know that there's always good fat there.
But if they take fat from this part of the body and put it here, what are you kissing?
I knew you would have to turn this into that. Do you know what, though? I will mention, you didn't make it too weird, but yes,
okay.
I'm used to it by now.
Okay.
Men, this is a really good option, he said, for men because, you know, when men get a facelift, it's hard to pull it off to make it look natural.
Yeah,
and so he suggests this as a good alternative for men. And it's natural because it's not, you know, synthetic or anything like your other fillers.
Stick that needle up there like that. Why would men want to do that?
It's just something out there. I'm just telling you about it. And Dr. Ptak has been doing this for quite a long time. It's not necessarily a new procedure. It's just been perfected. He's been kind of the pioneer of it.
I like what he said about there's some areas the body just will not let go of the fat. Yeah, I learned that.
Yeah, I can tell you that.
Yeah.
I got a few of those areas right now.
You don't, I do.